So we were very encouraged by these results, and that led us to propose and develop the treatment with exercise augmentation trial, which was funded by NIMH. It's a 4-year RCT and compared 2 distinct volumes of aerobic exercise, a 16 kilocalorie per kilogram per week dose compared to a 4 kKw dose. So I'll talk some about the study design. Basically, we designed the study to be very similar to what we would want to see in an optimal pharmacological trial of an antidepressant treatment. We targeted an acute phase treatment of 12 weeks. We had stringently diagnosed major depressive disorder, so we used the structured clinical interview for DSM-4 diagnoses. We had a treatment goal of remission, again, because as I mentioned, that's associated with the best outcome for depression. We looked at depressive symptoms as well as quality of life. We designed the study with the 2 doses to make sure, one, we wanted to look at the difference in the dose, but we wanted to also make sure that we were paying attention to having similar amounts of contact with the investigators in both intervention groups. The exercise was individually administered and self-paced, and there was a stringent calculation of dose and adherence and validation of unsupervised sessions with a heart rate monitor. So our target population were patients who had been on a selective serotonin reuptake inhibitor for at least 8 to 12 weeks. And of that period of time, at least 6 of those weeks should be at an adequate dose. So we wanted to make sure that it wasn't a situation where someone just hadn't been treated with a full dose of the medication, and that's why they weren't seeing a response. So we looked at 20 milligrams of escitalopram, 40 milligrams of paroxetine, citalopram, or fluoxetine, or 150 milligrams of sertraline as our target for adequate dose. And we were looking for individuals who felt some relief of their depressive symptoms, but felt like they did not have a complete response, so wanted some additional treatment. Our eligibility criteria, we had men and women in the study, 18 to 70 years of age. All had major depressive disorder diagnosis with residual symptoms, and this was quantified by Hamilton Rating Scale score of 14 or greater. As I mentioned, they had to have the adequate dose and duration of SSRI antidepressant therapy. They also had to be physically inactive and be physically capable of exercise. We excluded folks that had treatment-resistant depression, other primary psychiatric disorders such as bipolar disorder, schizophrenia, things like that. They were also excluded if they had significant cardiovascular disease or medical disorders, or if there were abnormalities on the maximal exercise test that precluded them to exercise.